Administration of Disease Control, Mr. Chen Youquan from the Supervisory Department of National Administration of Disease Control, Senior Researcher Madam Chang Zhaorui from Infectious Disease Prevention Control Department of CDC, and Senior Researcher Madam Chen Jing from the Environmental Study Institute of CDC. They will jointly take your questions. Now, floor is open for questions. Please identify yourself before you ask questions. With the CCTV, the prevention control policies adopted by our country is designed to be more scientific and targeted in our response. However, netizens are saying that there has been an increasing number of the infected, and it seems that the frequency of lockdown is higher than before. So how should we assess the role of the 9th version of prevention control protocol and the 20 optimized measures? Mr. Chen Youquan is taking the question. Thank you for your question. As you have mentioned, the pandemic is rapidly evolving, rippling into a wider area, and some localities have encountered the risk of a large-scale resurgence. Some localities are faced with the grimmest and the most challenging situation since the outbreak of the pandemic in the past 3 years. Some netizens and general public say the major problem is the oversimplification of the prevention control measures and arbitrary imposition of restrictions and one-size-fits-all approach. Some localities have arbitrarily expanded the areas and the people to be put on lockdown, and some regions, without approval, randomly put the entire locality on stack. At present, localities have established a ad hoc working committee to deal with the wrongful practice of arbitrary imposition of restrictions. The General Office of the Interagency Task Force is actively dealing with the complaints from the netizens and the general public. Each of the 20 optimized measures is supported by scientific evidence. It's not that the 20 measures are to replace the 9th version. Rather, we need to keep to the 9th version, implement the 20 optimization measures. The General Office of the Interagency Task Force has worked out 4 technical documents on NAT testing, risk zoning, home-based medical observation, home-based health monitoring. Prevention and mitigation response measures have been put forward. As long as localities are rigorously implementing these measures, we can effectively bring down the risk of the pandemic. Thank you. With Xinhua News Agency, which segment of the population are prone to the risk of progressing into severe cases based on the existing studies and researches? Madam Guo Yanhong is taking the question. Thank you for your question. In light of the treatment practice of COVID-19, there are several segments of the population that are prone to progressing into severe cases. First, the elderly. In particularly the elderly above 60 years old and the elderly above 80 years old. They are easily prone to become severe cases. Therefore, families and nursing homes with the elderly should pay special attention to the prevention of infection. At the same time, the senior citizens are advised to wear masks, have good hand hygiene, and avoid social gathering. And they are advised to adopt these effective personal protection measures. Second, patients with underlying diseases are more prone to become critical cases. In particular, people suffering from cardiovascular or cerebral vascular diseases, respiratory tract infections, and the chronic kidney failure or oncology diseases. These have reminded us that while we treat COVID-19, we should also pay special attention to the treatment of the underlying diseases of this segment of the population. Third, the unvaccinated population are more prone to become severe cases. We suggest people without contraindications, in particular the elderly who are eligible to be vaccinated, are highly advised to get vaccinated as quickly as possible. Going ahead, we will further improve the building of designated hospitals, in particular the improvement of cross-disciplinary or multidisciplinary treatment and nursing for the effective treatment of severe cases. Thank you. With CCTV, the financial channel, what is the progress of vaccination in our country, in particular the vaccination for the elderly above 60 years old, and the nasal inhalation formula of vaccination? Mr. Xia Gang is taking the question. Thank you for your question. At present, the pandemic situation is grim and complicated. Vaccination, it's still proven effective in preventing severe cases and deaths. The elderly and other vulnerable population are prone to progress into severe cases, critical cases, or even death. Vaccination benefit them most. As of the 28th of November 2022, across the country, we have already vaccinated 3,443,240,000 dosages, covering 1,345,000,000 population. 1,272,000,000 plus people have completed full-course vaccination. Those vaccinated and those completed the full-course vaccination account for 92.45% and over 90% of the overall population. 811 million people have completed boosted doses vaccination, including 47 million that have received the sequential vaccination. For elderly above 60 years old, 239 million plus people have received the vaccination. 228 million people above 60 years old have completed the full-course vaccination. The vaccinated population of people above 60 years old is over 90% of the total population segment, and 86% and plus have received the full-course vaccination. And for the booster doses, 227 million elderly above 80 years old have received the booster doses, and 23.56 million elderly above 80 years old have completed full-course vaccination. For those vaccinated and for those who have completed full-course vaccination for people above 80 years old, 76.6% and 65.8% respectively of the people above 80 years old, among which 46 million have received the nasal inhaling adenovirus vaccines.
The new work plan, in which we are going to take stock the baseline and optimize our services and publicity. Going forward, we will earnestly implement the requirements of the State Council and carefully organize and implement the vaccination work around the country, especially focusing on the elderly population. I also hope those elderly population, especially those over 80 years old, please take your own initiative to vaccinate and protect your own health. Thank you. Okay, please continue. Beijing News Daily, about 20 optimize the measure. It make further adjustments for the higher risk populations. If they stay at home, they are being infected. How can you guarantee the protection at home? Thank you for your question. For the high-risky population, according to the 20 optimized measures, for the higher risky population, we are going to have 7 days stay at home isolation, and on day 1, 3, 5, 7, we are going to have 1 NAT test. And according to the requirements, those stay-at-home patients should make regular reports, and if there are any positive case being tested within 2 hours' time, they need to transfer to the designated hospitals or makeshift isolation places. Based on these, we are going to have stringent management to their cohabitants as well as to control the overarching risks. Thank you. Please continue. From CMG. My question is about sterilization. Recently, some people say that the sterilization rate of ultraviolet is 99.9%, and it only takes 0.3 seconds to kill the virus, which is enough to reduce the pathogenicity of COVID-19. And some people would say that these UV and also infrared rays are also useful. What's your viewpoints? Ms. Shen Jin, thank you for your question. Ultraviolet rays are commonly used physical disinfection methods. We use UV lamp, UV air sterilizer, UV water sterilizer, and they can be applied on the smooth surfaces used for air and water bodies. UV rays have good capabilities for disinfection, but the downside of this is the poor penetrability. It would also cause damage to skin and eyes. For the traditional UV lamp, it takes 30 minutes to disinfect. In recent years, we witnessed the updated UV technology being developed. Having said that, we haven't seen the relevant information, literature, or reports show that UV can be disinfected in 0.3 seconds. In particular, on-the-spot disinfection due to the physical conditions like environmental temperature, and also the situations are different. So within such a short time frame, it's impossible to disinfect. Another one is infrared ray. And this is related to thermal effect. Currently, infrared disinfection is used for heat resistance tableware. Currently in China, all these infrared ray and UV disinfection have to follow the Chinese regulations and sanitary rules. Only by filing the record with the relevant authorities, you can go ahead with disinfection. And there are sometimes common household equipment being used by UV and infrared disinfection method. However, they never file an application with the authority, so we cannot guarantee there were no potential safety hazards. Thank you. From Phoenix TV, some people worried about when they do the NAT test, there are going to be cross-infection. How can you mitigate such risks? And since last year, we've seen some self-testing practices. Do you think it's very good to promote the practices? And also, currently there are some fake testing reports. What's the measures being taken by the government? Ms. Guo Yanhong, thank you very much for your question. We know that the NAT testing is a very important segment in the NAT testing. So to regulate the sampling procedures and to avoid these cross-infection risks are of vital importance. In particular, on the spot, we have clearly demarcated labels. We have the entry and exit points. All the people engaged should have one-way travel only, and we have very strict regulations and guidelines towards those orders and self-protection while you are waiting in line. And for individuals, while waiting for the testing, you should keep social distancing for more than 1 meter's time and wearing facial masks and follow the local working staff's guidance. Only after the person who is in front of you finish their testing, you can go ahead to approach the physician and the testing people, and do not touch the table and surface of the testing bench. And after testing, you should leave the spot immediately. Indeed, there are some localities and people are doing self-testing of NAT. We should guarantee the efficacy, efficiency, and safety issues on these self-testing, because the standardization and quality of testing and safety of the testing are of vital importance. Even if you are doing the self-testing, the quality is the key. For the self-testing and also for those testing institutions, we have a very stringent market entrance bars. We have also stepped up the regulation and supervision of the third part, the NAT testing institutions. In recent months, Hebei, Xuchang, Inner Mongolia, and Beijing, the health authorities had identified the issues and violations and loopholes in their testing practices. So the penalties are being imposed. Sometimes the individuals are also being punished criminally. And going forward, we're going to further strengthen our requirements and supervision for those institutions providing fake reports. We are going to pursue according to the law more seriously. Thank you. From People's Daily. For some localities, they've been locked down for a long time, and people are suffering from anxieties. So how could we avoid such challenges and problems?
Thank you for your question. Long-term lockdown will not only impact the general public's normal life and work, it can easily trigger anxiety. And such wrongful practices must be addressed and avoided. Therefore, localities should be trained for the better zoning of high and low-risk regions. In principle, high-risk regions is a single unit or even a building, but should not be arbitrarily expanded to a bigger scope. However, given the uncertainty of onward transmission, there can be expansion of the high-risk region at discretion. But this must be based on timely NAT testing results. Lockdowns should be quick. Removal of lockdowns should be equally quick. And the classification of people at risk should be based on epidemiological survey results and shouldn't be arbitrarily expanded. we need to minimize the inconvenience imposed on the general public. And for the high-risk regions, there must be rigorous control. At the same time, we must provide comprehensive and services to those people who are put on lockdowns. We need to provide psychological counseling to the people and also provide special care to the elderly, the weak, the vulnerable, and the disabled to address their practical needs. With China Daily, what is the virulence of the Omicron when compared with the original variant? Are there any changes to the pathogenicity in the different variants of Omicron? Madam Chang Zhaorui is taking the question. Thank you for your question. As to the virulence of Omicron, it is a question and the limelight. According to the monitoring data from both home and abroad, Omicron and its sublineages, BA.1, BA.2, and BA.5, including BF.7, BQ.1, and recombinant XBB. When it comes to their pathogenicity and virulence, there has been a substantial weakening when compared with Delta. The international researchers have shown that mortality and severe cases caused by Omicron have also seen substantial decrease compared with the original variant and VOC. In China, the critical cases and the fatality of COVID-19 has been kept at a relatively low level because of our well-coordinated measures and also the role played by TCM. However, for those with underlying diseases, senior citizens, and unvaccinated, once attracted the Omicron, there is still a certain percentage that may progress into the severe cases. Vaccines are proven effective in guarding against severe cases. Next question, please. With the Dragon TV, some netizens say that some senior citizens or even patients on oncology treatment, is it necessary to take people as such to camping hospitals if they are infected? What kind of treatment do they need? Madam Guo Yanhong is taking the question. Thank you for your question. Senior citizens and patients on oncology treatment are prone to progress into severe cases. That's why in our treatment, we need to pay them special attention. For senior citizens, many of them suffer underlying diseases, and for some, they have severe underlying diseases, and others may suffer from comorbidity. Once they are infected with the coronavirus, this might exacerbate their original underlying diseases, and they are also prone to develop into critical cases. For oncology patients, because of surgery, radioactive or chemotherapies, their immune system might be already compromised, so they are prone to develop into severe cases. We also know that oncology treatment shouldn't be suspended. That's why we have always been stressing that underlying diseases, oncology diseases, must be treated concurrently and in synchronous with the treatment of the COVID-19. We must have a scientific classification of the infected, have a proper arrangement for their treatment to ensure their safety and their health. People's life is above anything else. In our treatment, we have always been keeping to the principle of putting people and their life first. We are always people-oriented, and we have been taking scrupulous and painstaking efforts to organize treatment for the senior citizens and patients with oncology to facilitate their early rehabilitation. Next question, please. You can continue with your question. Thank you. With daily economic news, In the current response to the pandemic, the most commonly used disinfection method is the chemical agent spraying. What about those that cannot be disinfected with such a method? Madam Chen Jing is taking the question. Thank you for your question. For those contaminated objects or environments that cannot be disinfected with the chemical agent spraying, we can use other detoxification methods such as closure, sealment, and let it rest. In the 9th version of the Prevention Control Protocol, these detoxification methods have been listed. However, on different surfaces of objects and under different ambient temperature, the survival of the coronavirus is different. The severity of contamination also varies. Therefore, we need to carry out specific evaluation on the contamination risk, the natures and features of the contaminated object or environment before we decide what detoxification way should we use, either sealment or closure. Thank you. Next question, please. The lady from the right. Thank you. With Right Star News. Many senior citizens have difficulties in their mobility. It's difficult for them to move to the vaccination stations. What are the services provided to facilitate their vaccination? Mr. Xia Gang is taking the question. Thank you for your question. As you have rightly pointed out, many senior citizens are physically challenged to move freely. To provide convenience and facilitate their vaccination, in our vaccination working protocol, we have refined service measures for these elder citizens to optimize their vaccination services, including we can carry on some of the proven effective convenience measures, such as the fast tracks, green tracks for the elder citizens, and we have the mobile vaccination vehicles coming to the elderly to maximize their convenience. Localities can also set up teams composed of health professionals with rich experiences in diagnosis, treatment, and vaccination to provide services to the homes of these elder citizens. We must provide painstaking services to the elder citizen, patiently answer their inquiries, pay special attention to their physique. We also hope that by providing more affectionate services, we can better vaccinate the elder citizens. We also ask our friends of the media to mobilize the elder citizens to be timely vaccinated. Thank you. Next question, please. With CNS. Being it the 9th version Prevention Control Protocol or the 20 optimization measures, or from this press conference, it has been mentioned multiple times that we must be scientific and targeted in our prevention control. We oppose and say no to arbitrary imposition. Why are still violations in different localities?
Thank you for your question. Currently, we are facing intertwined, complicated situation domestically and internationally. Some localities are facing a lot of stresses. As a result, they had this over-practice of containment measures. From the public opinion and version 9 of the guidelines, we noticed that there are the following complaints from the general public. The first is unprecise, untargeted containment, which jeopardize people's life and livelihood. This is not aligned to the national policies. Secondly, the individual staffer the work method is very simple, and lack of patience, lack of good communication with the general public. Thirdly, in some few localities, the information disclosure is not adequate. So a lot of misunderstandings being caused. In order to resolve this over-practice of containment measures, the local government should shoulder more responsibilities and follow the national unified guidelines. And for those arbitrary school stopping and industry and production stopping, for those activities without any prior approval, we should name the shame, as well as pursue criminal responsibilities if necessary. Anyhow, we need to provide immediate feedback to the general public's complaints and concerns, and to resolve those pressing difficulties. Thank you. And from the paper, my question is, during the period of home isolation of close contact, what standards should be followed for their co-residents at home, the family members? Ms. Cheng would take the question. Thank you for question. The occupants or accompanying staff of home-based isolation personnel should comply with the management requirements of home-based isolation medical requirements. First, strictly implement the stay-at-home isolation and cannot arbitrarily go out. If there's a need for the urgent medical treatment, then you should make application to the community. Only after the approval, you can go out by using designated personal cars. And there's going to be closed-loop management and separate the rooms and toilet with the family members, and disinfect regularly if necessary. For those elderly staff and high-risky population, they should not be staying together with high-risky populations. Thank you. From the first finance. And currently, we face a lot of sporadic cases. Some localities being demarcated as high-risk regions, and some are being identified as low risks. What are the conditions or standards for demarcating such areas? What conditions being met? Then the places would be lifted from the lockdowns. Ms. Chang. Thank you for your question. According to the 20 optimized measures, in principle, such infected persons' home and workplaces are being demarcated as high-risk areas, and high-risk areas are generally designated by units or individual buildings and cannot be arbitrarily expanded. Other areas are designated as low-risk areas, especially for the area for consecutive 5 days, no positive cases being tested, then it should be regarded as low-risk area. And for those areas, satisfying these conditions should be lifted out of the lockdown. 2 more questions. From the writers.
Thank you. I would like to ask my question in English. Given the recent process in the country, we would like to ask whether the government, China, is reconsidering the COVID policy here. Thank you.
好，请翻译一下问题。
来自于路透社的记者，我的问题是：考虑到最近的个别地方的不满情绪，那政府呢是否会重新考虑疫情应对政策？谢谢。
好，疫情。
After the pandemic outbreak, the Chinese government follow closely about the mutation situation and evolving situations while we are doing the research and adjustment accordingly. According to the transmissibilities and the pathogen nature of the Omicron, as well as severe and death cases, we closely follow the evolving situations internationally. So for the containment and control measures, we are doing fine-tuning and modification continuously to the maximum extension. We are going to maintain and control the negative impacts to people's livelihood and lives. Thank you. From the Southern Daily, a lot of localities are facing the challenges of evacuation of those trapped personnel. So how can you alleviate this challenge? Mr. Cheng Youquan would take your question. Thank you. I think a reporter indeed studied carefully about these 20 optimized measures in which they talk about orderly and in an organized way to evacuate those trapped people. If there's a huge outbreak in a locality, under the prerequisite of containing the spreading of the cases, we should help and facilitate the evacuation in an orderly way. And for the receiving places and localities, they cannot reject the acceptance of such returnees, and there shouldn't be any strict and over practice of containment measures. And I noticed that there are some loopholes and weaknesses in some provinces and localities. As a result, the cross-region containment is not being achieved. Against this backdrop, the State Council had requested the receiving provinces to test and ask for the NAT testing results and traveling history to curb this spread. And for those provinces and regions haven't successfully contained the spreading of the COVID-19, they should properly and immediately demarcate the high-risk points and places. For those travelers not from the controlled or contained area, their QR code should be strictly checked. And also illegal transferring of passengers by trucks and buses are not allowed.
Second, for the unaffected regions, that regions prone to higher risk, we must intervene earlier by providing arrival tests for the inbound travelers. The returnees need to register with the local government. Communities should proactively have the screening. NAT testing should be conducted twice every 3 days for the returnees from the affected regions. Localities should have a proper assessment of the risk of imported cases. We also advocate that we need to provide care and support to people returning from high-risk regions. We must provide them with the support and need and meet their needs so that it is how a hometown should be felt like. Today, we have panelists sharing the latest measures in responding to the pandemic. We will hold future press conferences. Please stay tuned. Thank you.